If you have been recommended to have a penile implant, you're most likely suffering from erectile dysfunction that is refractory to traditional medical therapies, or have suffered damage from pelvic surgery such as a radical prostatectomy or radiation treatment for prostate cancer. During the procedure, you will have a small incision at the upper aspect of the scrotum, through which all the components of the implant will be placed safely. The procedure typically lasts only about 45 minutes. A penile implant is typically an outpatient surgical procedure and does not require an overnight stay in the hospital. Prior to undergoing penile implant surgery, it's important to check with your primary physician or cardiologist to ensure you have the right cardiovascular fitness prior to surgery. You should make arrangements for someone to give you transportation home after the procedure. Although I don't generally give any specific instructions to follow in the immediate days prior to the surgery, the next questions will address important guidance on medications prior to surgery. It's very important to remember to stop any aspirin or other blood thinners prior to having penile implant surgery. Generally speaking, I will ask you to hold your aspirin for 7 days prior to the procedure. Medications such as Coumadin or Eliquis should be held 5 days prior to the procedure. I will go into further detail regarding your specific case prior to surgery. You should not eat or drink anything after midnight prior to your penile implant surgery. You should remember to wear loose clothing on the day of your procedure. You don't need to bring a large bag for overnight because you'll be going home the same day. There is no need for you to shave prior to your procedure. On the day of surgery, you'll arrive at outpatient surgery and get ready to go upstairs to the holding area. You will change into a gown and meet our anesthesia team. You'll be given IV antibiotics and then brought back to the operating room where you'll have anesthesia and the procedure will be done. After the procedure, you'll go to the recovery room for a short period of time and then be able to go back down to outpatient surgery and be discharged with antibiotics and pain medication. A certain amount of nervousness prior to surgery is completely normal. I always tell everyone, if you're not anxious prior to surgery, something is wrong. However, most people tolerate the surgery very well, and anesthesia will give you medications prior to surgery to allay anxiety. I also have a patient advocate that we can use if you have specific questions that you would like to ask a patient who has already gone through this. If you have questions prior to your procedure, please feel free to call our office and speak with my medical assistant. I also have a patient advocate, a patient who has been through penile implant procedure previously, who would be happy to answer any questions you may have.